Now I'm going to explain to you what recurrent abdominal pain in childhood is like. It's really what I call a tummy ache, and how do we tell that that's what it is? This is a problem that occurs in children. It's very common. 1 out of 6 children get it, but usually between the ages of 8 and 12, and then it gets better as they go through puberty. So the way I explain it to a patient is as follows. I'm going to teach you to be a doctor. And what happens is, it's really easy being a doctor because all the insides send us messages. The esophagus, which is the thing that gets the food from your mouth to your stomach, it hurts after you eat. After you eat, puke comes up in the back of your mouth and it hurts up here. And that doesn't sound like the pain that a patient with recurrent abdominal pain has. So I'll put an X through that. Your stomach and your duodenum hurt before you eat when there's lots of acid there, and it hurts up here. That's not the pain that people with recurrent abdominal pain of childhood suffer from. So we put stomach and duodenum, we can put an X through that. Now your small intestine hurts after you eat, usually about 15 minutes to half an hour after. It comes and goes like waves, and it's around the belly button, a common place for recurrent abdominal pain of childhood, but very rare to have it after meals. And your colon hurts before you poop or you fart. Generally hurts down here, goes away when you have a bowel movement. Your liver never really hurts unless it gets really big. Your gallbladder can be in there, but the gallbladder only hurts maybe once every 6 weeks, once every 3 months. It's terrible pain, got to go to the hospital. So it's not the pain of recurrent abdominal pain of childhood. So we'll put an X through that. You have a pancreas in there. It tends to hurt in your back. That's not the pain. And also you have to go to the hospital. And also I always say we have some pee stuff there. That hurts usually in your back or in your groin. It hurts before you pee, gets better after you pee. Now, what we do is we ask all these questions to see which organ hurts the most. Now, the thing in recurrent abdominal pain of childhood is it usually hurts around the belly button, not on the left or the right. It tends to come on any time of day, morning, noon, or night. It's not related to what we call visceral function, which is your eating or pooping or peeing, and it tends to come and go, and it typically lasts for about half an hour to 2 hours. The child tends to moan and groan with it, and they don't get, and they tend not to cry with it. And it tends to occur usually several times a week in a child that's doing well otherwise. So that's how we diagnose and how we explain recurrent abdominal pain of childhood. Now, it's important to know that recurrent abdominal pain of childhood is a real pain. It's not a pretend pain. I had it when I was a kid. I saw a bunch of docs for it. I actually missed a lot of school for it. It's a real pain. The fact that it isn't related to anything inside doesn't mean that it's not a real pain. It's like a headache, but it's in your tummy. And the good news, it's going to get better with time. And unfortunately, the medicines don't really work very well, and the ones that work tend to have big side effects, and we try not to use them. So remember, it's a real pain in more ways than one, but it's going to get better.